Hi, so today I will be talking about mental health access in immigrant communities, especially among Indian, Vietnamese, and the Mexican populations in the Bay Area. So this issue is both personal and systematic, and it's one that I've seen firsthand. Why this matters. Mental health is essential to well-being, but care is deeply unequal across racial and ethnic lines. In immigrant families, mental health is often dismissed or seen as a weakness. The stigma combined with cultural silence can make it almost impossible to seek help. So some key barriers are cultural stigma. So this discourages people from acknowledging mental illness. And cultures tend to dismiss mental illness as something insignificant. Also, language barriers are a big one because they make therapy inaccessible, which we will get into later. But language barriers are one of the biggest ones in the Bay Area where there are many different languages spoken. Having a therapist who speaks your language is really hard to find. Again, a lack of representation in healthcare. Few therapists can really fully understand an ethnic background and relate and provide insight based on an ethnic background. And again, immigration-related stress adds fear and instability, especially people who are DACA undocumented or who are on a work visa and not full citizens. So it's not just cultural. We can see that the mental health access in the Bay Area especially is also structural. The American healthcare system wasn't built to serve non-white people in non-Western communities. A lack of culturally competent care has disproportionately harmed immigrant populations. So we can see that a lot of therapy sessions and programs have been created for white people supporting white narratives. And in turn, people of color with ethnic backgrounds do not find therapy accessible, and it is just not built in order to find therapy. So some historical context. The Vietnamese came post-war trauma and refugee status in the 1970s. Mexican immigrants have had long-standing immigration disputes in the U.S., especially along the U.S.-Texas-Mexico border. And again, many of them are undocumented. Indians came around the 1965 Immigration Act boom, which kind of forced them to assimilate. And again, a lot of these groups, there's not one set way in which they came to America. This is just an overview. So then community-specific challenges. So in San Jose, Vietnamese immigrants in the 80s and 90s struggled with war trauma, but there were no services available for them. A lot of people talk about veterans and the PTSD for veterans and veteran care and such, but when you add in, and how bad those programs are, but when you add in people of color and of ethnic backgrounds, those services tend to get even more sparse and even worse. Again, undocumented Mexican immigrants feared seeking help, fearing deportation, which is still an issue today. And for Indians and, in general, Asians, the model minority myth, which we learned in class, they were expected to live up to that image of being perfect, successful, and obedient, which meant hiding their feelings, leading to isolation and a lot of intergenerational pressure. So, COVID-19 and current gaps. So, immigrants, the pandemic obviously worsened these gaps in mental health because everything was online. So, not just in immigrant communities, but depression and anxiety skyrocketed among the entire population due to isolation and rapid changes in societal structures. But studies have shown that this is especially skyrocketed in immigrant communities, especially people living in multi-generational homes or where family members were separated by language barriers. So even with more public conversation, these research and all the research about this phenomenon, there's still these communities, the immigrant communities, remain underserved in terms of mental health. There is not a lot of services, even though we know that these gaps exist. And then talking about race and mental health narratives. So how is mental health even talked about, and who is allowed to seek help and receive therapy, I guess, is often shaped by race. So Vietnamese and Mexican immigrants are often pathologized as refugees, illegals without systemic support, and often dehumanized for their immigration status, when in reality there is so much more to receiving therapy than one's immigration status. And then again, on the other side, Indian Americans again are back to the model myth minority, is they are expected to be high functioning, and which leads to a lot of denial and underreporting in terms of mental health and feelings and how they feel. So diagnoses are off, and So then, harmful immigration policies, this is very relevant today, but policies like the public charge rule under the Trump administration discourage immigrants from seeking help, especially health care, out of fear that it would affect their status and lead to deportation. Even though it's in the process of being revised, the effects still remain, the effects are still present, especially for undocumented and mixed status families. So even though these policies are being revised, you can still see their effect, because from the time a legislation passes in Congress to when you see the effects in society, it can be quite a while. Okay, so then workforce and access gap. So this kind of bleeds into the lack of culturally competent providers. So there is a severe shortage of bilingual or simply just therapists who speak other languages, namely Spanish, Vietnamese, Hindi, Punjabi, Cantonese, Chinese. There are a lot of therapists who only speak English, which is okay, but having more bilingual therapists would increase the outreach and how many people they can reach through their services. So, licensing systems don't really recruit or support immigrant background clinicians effectively. They tend to favor people who are white, because in the past, therapy has been seen as a luxury for white people or the wealthy. And that's why a lot of immigrant families and communities tend to look down upon therapy. So concepts throughout the course that have helped me understand this problem. So one is the structural racism. I can't remember which week this was in specifically, but essentially it explains how systems can disadvantage people without explicit discrimination. So even though one might not experience racism on a day-to-day basis from, another person or a colleague or at school or whatever, they can still experience racism through structures and systems, such as the healthcare system in this example. Again, the model myth minority, which just basically states that, Asian communities in America tend to view them as more complacent, obedient, quiet, high-functioning. So that kind of silences a lot of stories in terms of mental health. And then intersectionality, the concept of intersectionality was really, really important for this, because it's not just race that affects mental health access. It's, your environment, your family, the people you're around, but you can also see how legal status, gender, class, economic backgrounds, they can combine to create extremely unique barriers from person to person. Okay, so what needs to change? So to fix this, there is not exactly one route to fix this, but definitely we can start by funding and training more bilingual and bicultural professionals who understand a variety of backgrounds. I know for me personally, going to therapy with a person of color has been a lot more helpful than a white therapist, which makes sense because it's easier to relate. They can provide more insight based on their experiences about my experiences. So we can also offer services in multiple languages as well, going on top of that, bilingual. If, there's a shortage of a therapist, there can be programs and group therapies and different courses and stuff that can be translated into different languages to access. We can also try reforming immigration and healthcare policies so that people aren't afraid to seek help, such as a public change policy. And then on a community level, one of the main things is stigma and taboo talking about mental health, and this can mainly be done through schools, faith leaders, churches, places of worship, and the media. Media is a big one because almost everyone is on social media nowadays, and it's very easy to spread information through media. So my personal role in this, I can start by talking about mental health in my own community. I work at a yoga studio, which is a great place to talk about mental health. I also tutor, and I also go to school. So these are all communities that I can talk about mental health and advocate for change. Local organizations, there are a few in Santa Clara County that support mental health access, not just to immigrant communities, but just underserved communities in general. And even in the future, looking long term, this is a topic I'm very passionate about. So working in public health, education, advocacy, I think for me that would look more like working in law. I really want to be a lawyer, so that is where I see my personal contribution in the long term or in the future. And then obviously the long-term dream is that no one's mental health is ignored because of their race or immigration status, gender, class, anything like that, because it's becoming now more prevalent that we need to talk about these things. And these are my sources. Thank you so much. And let me see.